The supply of medicines to Northern Ireland should continue to be guaranteed despite the Brexit rules. On Tuesday, the EU countries decided on further exceptions for medicines from Great Britain, which should then be able to be delivered smoothly to the British region in the north of the Irish island, as the Council of the EU states announced. Similar rules have been agreed for the EU states of Ireland, Malta, and Cyprus for the next 3 years. The regulation is to come into force retrospectively as of January 1st, 2021. Since Brexit, there have been trade difficulties, particularly in relation to Northern Ireland. Checks between Northern Ireland and the rest of the UK have been agreed to ensure that goods do not get unchecked from Great Britain via Northern Ireland to Ireland and thus into the EU. This sometimes led to problems for which London and Brussels blame each other. For months, the British government has been declaring that an agreement they themselves had negotiated has failed and is demanding a fundamental renegotiation, which Brussels, however, rejects. The so-called Northern Ireland Protocol stipulates that Northern Ireland, unlike England, Scotland and Wales, will continue to follow the rules of the EU internal market and the customs union. This is intended to prevent tensions in the former civil war region of the island of Ireland. For months, London and Brussels have been negotiating how to proceed without making any visible progress. The British have repeatedly threatened to withdraw from the protocol altogether. The European Commission welcomes the Council's speedy adoption of proposals to ensure the long-term uninterrupted supply of medicines from the UK to Northern Ireland and to remove the remaining supply shortages in Cyprus, Ireland and Malta, markets that were historically closed or closed were supplies via Great Britain. Today's adoption, or the Tuesday's adoption, was preceded by a positive vote in the European Parliament last week. The proposals were presented by the Commission last December. They were based on both an extensive dialogue with the EU and UK citizens, industry and other business stakeholders, and in-depth discussions with the UK government on this permanent solution. Welcoming this acceptance, Vice President Šefčovič said, "During my visit to Northern Ireland last autumn, I promised to do everything possible to ensure an uninterrupted supply of medicines in Northern Ireland. Now we have found a permanent solution and in record time. I will continue to work closely with the UK government to ensure predictability, legal certainty and prosperity for all communities in Northern Ireland." And Commissioner for Health and Food Food Safety, Stella Kyriakides, added, "Uninterrupted supply of medicines is essential for hundreds of thousands of patients in Northern Ireland, but also in Cyprus, Ireland and Malta, whose medicines markets have traditionally relied on supplies from the UK. We have now kept our promise to find a solution so that all citizens can always get the medicines they need. I very much welcome this swift agreement between the European Parliament and the Council." The COVID-19 pandemic has shown that having stable supply chains and access to medicines at all times is of paramount importance for healthcare systems to function smoothly. For Cyprus, Ireland and Malta, the rules approved by the European Parliament and the Council include a temporary derogation allowing them to continue to source medicines from the UK if there is a need. The directive and the regulation apply retrospectively from January 1st and January 31st retrospectively. There are two different cases. The temporary exemption are expected to be implemented within 3 years. That means by December 2024, and will reduce the domestic market's dependency on supplies of medicines from the UK and parts of the UK other than Northern Ireland. In addition, before the end of this year, the Commission will present proposals to revise EU medicines legislation. The aim of these proposals is to find long-term structural solutions, in particular as it regards access to medicines, improving security of supply and avoiding the risk of bottlenecks in the Union's smaller markets. The solution is part of the package of far-reaching measures proposed by the Commission in October 2021 to respond to the difficulties faced by the people of Northern Ireland as a result of Brexit. So once again, you have a very good example who really cares for the people of Northern Ireland. And I'll see you in my next video. Bis gleich.